Hi, welcome to Unique Parenting. I am B Moise, and today I want to talk to you guys about anxiety in kids. So, anxiety in children tend to look a little bit different than anxiety in adults because adults, we can figure out how to manage our own anxiety. I know some of the ways that I manage my own anxiety is basically through avoiding it. If I avoid it, there's no anxiety. But we can avoid tasks and things that makes us anxious or things that makes us uncomfortable. But with children, they don't have that option. So they're constantly facing their anxiety. And the only way they can avoid stressful situations and the only way that they can communicate that they're in a stressful situation is through behavior. So behavior is communication, good or bad. I do sound like a broken record, but I will always say this because it's so true. Behavior is the way that kids communicate things to us because they don't have other ways to do so yet, but we can work towards that. So it's going to show up in behavior. So if you see a child that is avoiding a particular task, or that, there's an increase in a negative behavior or undesired behavior, they may be anxious about it. They may not have the language or the skill set or the communication tool to be able to tell you, I don't want to do this. This makes me anxious. This makes me uncomfortable. I don't like the way this feels. So they could say all these things if they had the language or the ability to, but if they do not, it's just going to show up with bad behavior. So always be in tune with your child, with their behavior, to see what they're trying to communicate to you, because that's what anxiety tend to look like. And kids also can shut down. So anxiety can be an increase in some kind of undesired or negative behavior, or it could be a removal from the environment, meaning the child is just shutting down and they don't do anything and they're just kind of like sitting there or not moving, and it just seems as if they're stuck, that fight or flight, and they're like frozen. And if they're frozen in time, in the moment, they may be anxious about what's happening or the situation. Again, it is not beneficial to try and push that child, to make them go through that moment. It is more beneficial to try and figure out, okay, what can I do right now to help you get over this moment? Is it to remove you from the environment and kind of give you time to unwind and figure out and collect yourself? Or is it a conversation? You know your child. Try and see what different things that you could use to make them, understand that this is what they're going through, and so that they can know next time, oh, I remember this feeling before and I remember what I did, and let me see if it will work again. So those are ways that sometimes anxiety manifest themselves in kids. Also, anxiety can be just the environment. Like, the environment can produce anxious feelings. I do not like crowds. Sometimes they're overwhelming, but I'm an adult. So if I don't like crowds, I figured out ways to avoid it, or ways to kind of manage it. And I can do earplugs, and I can headsets, and I could do all these different things, and I can also avoid it. I can also just not go out. But if I'm a kid and I don't have these options so easily available to me, or it's just not something that is feasible, I have to face this fear. So really come up with different kind of sensory exploration needs that a child can use to help them manage their anxiety in the setting. Now, obviously, if you know your child have anxiety and you are trying to figure out alternative ways to manage their anxieties, these are some suggestions. Obviously, if they need medication, that's something completely different. Just because sometimes anxious kids need something greater than just conversation about it. But it's most important that as a parent, you understand and recognize that they're not, trying to exhibit bad behavior. They're not malicious in their intent with these behaviors. It's just simply a way that they're communicating, and this is what they have. So really, as a parent, to understand that and see it and guide them. Also, anxiety tends to live in the future. So if you're able to, meaning if you know what's coming up, let the child know, because when we don't know what's coming up, we get anxious about it. That's the future. So you start to think and think and think and really become, overwhelmed with this feeling of what may happen, what could happen, what might happen. In reality, it hasn't happened. So if you can help the child figure out, okay, this is what's going to happen, even something as simple as for someone else, it may be something as going to the dentist. That may not be an anxiety producing thing for you, but it may be for a child who's never been, or who has a fear of a dentist, or who's been to a previous dental office and it wasn't a good experience. Talk them through it. Do video things and pictures, and try to as best as you can, the way that child communicate, to show them what's going to happen. Talk through it, just so they have the understanding of this is what's going to happen, and they can recognize that feeling in that setting, so then they're not as anxious, and it decreases their level of anxiety in that situation or in that setting. So just remember that anxiety can show up in children as behavior. The behavior is not an indication that the child is bad or malicious, or that they'll always be anxious about this thing. Sometimes exposure just helps them manage it for next time. So they may not always be anxious, but just recognize that it shows up as behavior, and they're just trying their best to communicate with you as best as they can. So in the meantime, I want you all to enjoy your unique parenting journey with your unique learner.